Public health officials are handing out drugs and alcohol to San Francisco's homeless population.
I'm sorry, what?
Public health officials are handing out drugs and alcohol to San Francisco's homeless population.
Oh, that's what I thought you said. What the?
San Francisco is taking a controversial approach to keeping at-risk communities safe from the coronavirus. Recent reports say the city's public health department is providing alcohol,
Right.
marijuana,
Sounds like a good time.
and methadone
For all my heroes in the methadone clinic.
free of charge.
Wait, free of charge? Who's paying for this?
The department said private donations, not taxpayer dollars, are being used to provide the drugs and alcohol.
Still, that begs the question. So the government is allowing drugs and alcohol, maybe the illicit drugs, to be provided to the homeless during their stay in hotels. Right. So you heard that news report from OAN correctly. And this is the San Francisco Chronicle. That, oh my God, this is insane. Now, I shouldn't be surprised this comes from San Francisco, but I am. So I'll go over what this says. It says SF gives methadone, alcohol, cannabis to some addicts and homeless isolating from coronavirus in hotels. You know, I don't think anything could go wrong with this. You think so? I don't think so either, because I mean, who would lie and say, "Yeah, I'm on drugs. I need some methadone. I need some cannabis. I need marijuana, cigarette." Oh boy. All right. San Francisco's health department confirmed Wednesday that the city was administering alcohol, tobacco, medical cannabis, and other substances in an effort to prevent a handful of people quarantined or isolating in city-leased hotels from going outside to get the substances themselves. So let me get this straight. They got the HIV, or the Cove, or the 19, if you will. So the government doesn't want them to go outside to score. So they're going to deliver the drugs to their hotel room. Where can I sign up for that? Hotel residents are also receiving medications such as methadone. I didn't know that was a medication, but apparently it is, to get yourself off the dragon. Delivered by methadone clinics to tamp down heroin cravings. Right. It's all part of a widely used harm reduction approach to helping addicts stay addicted, apparently, and stay inside and curb the spread of the novel coronavirus while coping with the loss or reduction of their core drugs. I mean, what could go wrong here? I mean, seriously. News of the health department's efforts was first reported by television KTVU. The city-rented hotels have been reserved for individuals who either have the 19 or are heightened risk of catching it. Wait, we're all at a heightened risk of catching it. So why am I not getting drugs delivered? Well, that's right, I'm not in the United States right now. Yeah, that makes sense. And who have no space of their own to safely self-isolate or quarantine. And some of those individuals have substance abuse issues or already on methadone regimen. Again, nothing can go wrong here, right? The city's health department is doing what it can to help those individuals through the duration of their self-isolation or quarantine period, said Jenna Lane. Sounds like a porn name. A spokesman for the Department of Public Health. Quoting, I guess, from Miss Lane. I guess I'm assuming her gender. You can get guillotined in San Francisco for that. They're doing San Francisco a great service by staying inside. Not for the hotels, probably. They're probably getting tore up from the flow up. We're saying we're doing what we can to support you staying inside and not have to go out and get those things. What things? You mean illicit drugs? Right. The health department is also making clinicians and social workers available to anyone who wishes to begin addiction treatment. Oh, you see, there it is right there. The health department is also making clinicians and social workers available to anyone who wishes to begin addiction treatment while under the DPH's supervision in the hotels. Really? So let me get this straight. So as long as you have the Cove, the HIV, I call it the HIV, but whatever. The 19, the COOF, the human malware. And as long as you're like, I want to keep on the drugs, and you just kind of, would you like some addiction, pamphlets? Nah, I'm good. Just give me some more medical cannabis. And some of that methadone. No taxpayer money was being used to administer the substances to hotel guests. Lane said only private donations. But, the city is allowing this activity to continue. Now, I know what you're going to say. Well, Laszlo, you can go out and buy medical marijuana and or other medical marijuana services at other places. So what's the deal? Well, they're bringing it. The government is allowing it, making it legal to deliver that stuff to a non-medical facility, if you will, to a hotel. I see where I'm getting at this. It does not pass in the sniff test here. There are around 270 people in city-leased hotel rooms who are waiting out self-isolation or quarantine periods, most of whom are homeless. Most of whom are homeless. So you're saying there's some guy, in a Fortune 500 company hanging out there getting, juiced up on some methadone and some free medical marijuana. Other rooms have been set aside for vulnerable homeless people who may not require the human malware isolation or quarantine. Jesus Christ. Oh, I can't believe I'm going to... Okay. Those receiving substances... I must be on the methadone regimen here. From the health department represent a small subset. A few dozen people of the population stay in hotel rooms to safely self-isolate or quarantine. 11 of those under isolation and quarantine have received alcohol from the health department. Yeah, let me get a gallon of orange juice and a couple of quarts of vodka, please. Really? And around 27 have received tobacco. Let me get a carton of unfiltered Camels, please. Oh, yeah. Flavor country. So health department workers are calculating how much alcohol a hotel guest needs to stave off the effects of mild withdrawal. How about all of it? For those guests, the DPH medical staff are calculating the minimum medically appropriate amounts of alcohol and distributing it with the meals. Lane said, alcohol withdrawal is the only one you can die from. But you see, if they're alcoholic and you're only getting some, that's still going to lead those guys who want more, or gals, to go out and buy alcohol. You really think these homeless people can't score on the outside, even though they're not supposed to leave? You really think someone's manning the doors? No, they're not. T Wolfe at my T Wolfe family stated on Twitter, I just found out homeless placed in hotels in SF are being delivered alcohol, weed, and methadone because they identified as an addict or alcoholic for free. You're supposed to be offering treatment. This is enabling and is wrong on many levels. And of course, the SF DPH blue check mark, because they're authoritative sources, so say you, YouTube. Those harm reduction based practices, which are not unique to San Francisco and are not paid for with taxpayer money, help guests successfully complete isolation and quarantine and have been significant individual and public health benefits in the human malware pandemic. Really? You're just enabling these people. But hey, what do I know? Because San Francisco passes through a special membrane. They know more than you do. But one drug counselor in the city has trouble with cannabis and liquor being handed out. Quoting from this guy, Thomas Wolfe, I have it from a pretty reliable source that weed and booze are being given to people in the hotels. And I have a real problem with that, said Thomas Wolfe, a case manager who works with addicts in San Francisco. There's an ethical issue here. Yeah, there is. Alcohol kills more people than any other drug. Yep. And I understand the risk of having people detox in hotel rooms. But my understanding is that people who are quarantined in hotels can leave for 30 minutes for essential services. Ah, that's what the SFDPH hasn't said. Let's see. So if you have to get what you think they need, that's what they should do. But don't deliver it to them. He also pointed out that while marijuana is legal in California, it is illegal under federal law. Exactly. Which might put the Federal Emergency Management Agency funding for some of the hotel costs in jeopardy. Probably not. We want them to stay inside, but man, you've got to draw the line somewhere and ask for more accountability, said Wolfe, who was a homeless addict before cleaning up years ago and becoming a counselor. Good for him. Don't be enabling people. Yeah. Alameda, Santa Clara, and Contra Costa counties are also using a harm reduction approach in their hotels, administering medications to keep addicts stable. According to officials there, a program similar to San Francisco's is also being placed in King County, Washington. Notice, just notice who runs California predominantly. Leftist progressives. Who runs King County, Washington, and most of Washington State? Lefty progressives. So isn't it any wonder why they're doing this here? Have you heard this going on in anywhere other state? Probably. I'd have to dig in and do some little bit of a cursory research, but I could probably find out it's probably going on in New York City, Chicago, Boston. Let's see, where else? I don't know. But the point is that this is ridiculous. Look, I get it. You're an addict, and this is some precedent times. But the state using a non-taxpayer or probably GoFundMe money to fund addicts while they're staying in a hotel, delivering drugs with their meals? Wow. That's day 57 in a nutshell. I'll see you later.